Awesome. Okay. So first I want to definitely say my name is Vanessa Chambers. I'm an RN, BSN included. And I've been a owner of a company now going on about years when we launched, but about 5 years. I started in COVID times. But I've been doing this concierge bit on my own for about maybe a decade. And I tell you right now, it's truly, truly an art form. But what I've also noticed is that most people don't know what the hell it is or confuse it with agencies, which is, I love agencies, been with them for years, but there is a subtle difference, it's a not so subtle difference. And I felt that it needs to really be more addressed and how it's actually helping patients out in the post-op region. And of course, there's nurses here too who see content like this and who see what we're going with it might want to also delve into this business because it's a beautiful business. And I really do feel that patients are a lot happier once they start working with concierge nursing. So without further ado, so I want to go into what in the world is even concierge nursing in general. So it is that private one-to-one type of care. It's nurse directed, of course. It happens on the patient's terms at home, on their schedule, and there is no bureaucracy. I think this is why it really does resonate with a lot of nurses because it takes away all that hospital aspect and you're more singular. But what you also must realize is that even though there's no bureaucracy, you are now that person that takes care of everything for the client. They are expecting a different level of care. So that typical, I'm going to call the agency and that's all gone. This works in a team aspect. This works in a, you go into that home and you're taking care of everything that patient is asking for within the confines of your license. They are looking for the precision, the high skill, the white glove. It's truly a customer first type of industry. They're looking for flexibility. There's no like, I'm going to see if the insurance company covers. No, they're typically paying out of pocket. And so they're expecting you to be flexible. They're expecting that the care is continuous. There is no break in care. They're expecting outcomes, not necessarily just your skills. They don't know what your skills even mean. They just got a G tube and they ask for a concierge nurse. You can't really go into too much jargon. You know what I mean? You need to actually say, hey, we're there to make sure that you get all the nutrition that you need to be a stronger and more capable person. That is your post G tube. So even just how you approach once you go into the home or once you pick up that phone, it's a big difference from just an agency. So what I found is that there were some gaps and some of the problems when patients are coming out of surgery, especially orthopedics. They would have limited home support, not even realizing that home support is even something that they need to even worry about. They are missed medication dosages, missed red flags. Mobility is not enforced. Once they come out the hospital, they hear, oh, I got to go for PT. But they don't realize that PT is only 2, 3 times a week. What about the rest of the days of the week? Why you're not moving as much? You start to see why your recovery is taking longer and longer than it should. Poor nutrition, hydration is never really taken seriously. Families, they help as much as they can help. But if you're not so great in understanding what to do for your care, then there's a possibility that your family doesn't either, or the friends around you don't either. Delayed follow up. I can't tell you enough how much I'll go in and they don't even realize that they need to see their PCP in a week. They don't realize that they need to still follow up on their care. They went to the hospital, they came home, they thought that's it, but it's still continuous. What I find is that they don't understand that there's a real world consequences. And when that post-op plan fails apart or falls apart at home, the fallout is extremely predictable. You can see that there's a possibility of being readmitted back to the hospitals and they may have preventable complications. There's no one watching to make sure that they're okay, to watch out for those early warning signs. Those small issues start to snowball into a bigger effect, and then the next thing you know, they're getting readmitted. Or now they're going to spend even more money when it wasn't necessary, when they could have just had a nurse come out, concierge nurse, just using their skills instead of waiting for either an insurance company or a doctor or a social worker to say, yeah, you may need someone, when they could have just reached out from the beginning.
To everyone, and for those of you who are new here, I'm George. I've had 4 ACL surgeries, 5 ACL injuries, and 1 severe wound infection that landed me in hospital for 3 nights. That infection meant another surgery to wash everything out, 2 weeks with a PICC line, and 4 weeks with a Pico dressing. I'm now 4 months post ACL reconstruction and high tibial osteotomy. And the question I get asked most is, how's your knee going? It sounds simple, right? But it's honestly the hardest question to answer. I end up just saying good because it's easier than trying to explain everything, but it's never really been good. The journey is complex, and for everyone who's been through knee surgery, you'll know. No words can truly describe the pain, frustration, and emotional weight that comes with it. If I were to answer honestly, I'd say I'm doing better physically, but mentally, that's another story, been full of setbacks, brick walls, and moments where it's taken everything in me to keep going. Now it's just a waiting game until the hardware in my tibia can finally come out. So as I continue with antibiotics for the next 3 months, maybe I'll find a shorter way to answer that question. But for now, just know good doesn't even begin to cover it.
When I first saw her TikTok, I just saw this very young lady just had ACL surgery. And she talks about that she had an infection when she got home. It took her days to really address the fact that she has an infection. By that point, it already hit the bone. Wound disruption. On this chart here, you'll see wound disruption is almost 20 days that you stay in the hospital. And if any PTs are on here, they know one extra day in the hospital could mean a week of recovery. So now you're looking at weeks of trying to recover after you had an infection in a surgery that should have given you a lesser time in the hospital, a very short time, especially at ECL, you go home sometimes the same day. Or, you're spending so much more money than you actually thought you ever would. So what I found is that if they had a nurse come out same day that you go home, they could have caught that infection, or even if she has someone to even call to do a Zoom meeting, to do a FaceTime meeting, they could have noticed that there was an infection brewing much, much sooner before it got as bad as it did for her. It took her weeks and she's still recovering. Concierge nursing, we're really, really heavy as a company on orthopedic surgery. And why? Because most people, they get that surgery to their knee, to their hip, and they think that's it. They're good, they go home, they're good with pain, and don't realize that by next morning, blank. Sometimes even the same night, blank. They're going through this big book of papers of a whole bunch of jargon. They're looking at the medication list and they're just like, why is that even longer? Why is my other medication not there? There's no one to really talk to, communicate, especially if you had a surgery, God forbid, on a Friday. It's the weekend. Forget you trying to get somebody on the phone. Nursing, we identify, we address the risks. As a private nurse, we catch those red flags very, very early on. We ensure that there's proper planning, private nurse coordination, logistics, surgeons that never have to touch all that. We help those surgeons making sure their patient goes through the recovery process appropriately. We reduce the surgical complications. Most of the time, folks go through a lot of these surgeries and they'll realize there's different techniques, and every doctor is a little different. Even just the way that they deal with the skin afterwards or the dressing that they use. And while that patient is getting all that education before they leave the hospital, how much do they truly retain at the end? Not much. And that's why they really do need that nurse there to go over with them. The physicians, unfortunately, did not necessarily have the time to go over everything. And the time they take, they got to go through it quick. So that nurse is there to really break it down for the client and continuously, because sometimes repetition is what they need more than anything else. That's why I really do believe pre-op care is important to have. Now you'd ask why? Why would you need pre-op care? Let me ask anybody over here in the lovely audience, if anyone can pick their hands up and tell me, have they ever had any kind of surgery at all? Is there anyone that's ever had any type of surgery at all, orthopedic or anything of the sort? Okay. So we had one person maybe. All right, all right. That's fine. So, and that's good because I don't want everybody to have surgery. But I'll tell you this much. How much would you have benefited? Two, how much would you have benefited if someone was to come out to your home prior to you having that surgery? Giving you more than just information, but also setting up your home for success. How many people would have preferred to know that they need to make sure that they have right food in their home, that everything's accessible to them? It could be the smallest things and appliances on how to put back on your shoe if you can't bend down that low, depending on the surgery that you had. Or just seeing how who you were prior to surgery and knowing that if there's changes, they can address it because you're different than where you were before surgery. It's having that pre-op care prepares your mind, that nurse putting you at ease, seeing how your family dynamics are. And I don't know if anybody comes from any kind of crazy families, but who's going to be there not only just to take you home, but who's going to be there overnight on the first night or the same day or the next morning? Sometimes the insurances don't kick in as swiftly as you would like to. You need to know like what's the dynamic like beforehand. So that pre-op care, it really brings down the anxiety that our patients are having and they have a smoother transition. Now you've made it through surgery, right? You got the pre-op care, you've gone through surgery, and you got all the instructions, and now you are ready to come home.
TMZ, come on here. You put her vlog in. She doing the TikTok to follow her leg journey. I know. So she could do a voiceover and say, "This me going in the house." Right, Erica? Come on.
Now, this is not typical, right? You're coming out of surgery, you're still loopy. You're still loopy. And you feel like you could probably conquer the world. You feel like you're all right. Those first 72 hours after you come out of the hospital is the most important time. It's the time that you could have a setback, incisional issues, you could fall. Education, having that nurse look out for you, even on a visit. They don't have to stay there all day long. Even as a visit, it can mitigate so many issues. I just want to ask before I just continue, does anyone have any questions at all? They can unmute themselves and ask, or I can just keep on continuing, just making sure. Okay. So I just found that video really just synonymous of what a lot of the clients go through when they are discharged. Loopy as ever. And you can see, imagine now she goes home and there's nobody there. There's no education there. How she's going to go through all the things that she doesn't even understand, never went to school for, and take care of herself for the next 72 hours. It's critical. I want to talk on a case study. And this is a case study that I dealt with. She was 72 years old. Obviously, I can't go into her name. Female discharged home after abdominal surgery resulting in a new colostomy bag. Never had a colostomy bag in her entire life. And I can tell you right now, this was in 2020, the start before COVID, just before COVID hit, just before the shutdown, I should say. She lived alone. She had no family support. She was sent home with general instruction and a standard home care referral. Obviously, the biggest problems, diet adjustments. She never had anything hanging out of her stomach before. Bowel pattern tracking, infection prevention routines, colostomy changes, all these things. And all she really got was an aide twice a week, a nurse once weekly, and she was just overwhelmed, anxious, and unable to manage. So by the time she reached out to me and I got to that home, I could smell the feces. I could smell that there were problems, and I could tell she was so overwhelmed and so scared. And she's just like, I don't know what I'm going to do with this thing on me. I had to, it was supposed to be reversed in a short period of time. It ended up being approximately a year and a half because of the COVID situation, the shutdown, and she had to be pushed back. Her surgery was pushed back over and over again. But I'll tell you this, we were there from the beginning to the very end as a solo nurse there. And I can't tell you how she still continues to call me and say thank you. And it was just that level of support. She didn't have to go through the bureaucracies. She came straight to me. I knew exactly what I need to do. I work with her schedule. I work with her anxiety. And we did more than just, you know, clean her up. It was giving her that peace of mind that she can call and talk and go through all the motions with us. It concierge goes above and beyond just your skills because the whole point is what? To have an outcome, to have peace of mind, to be better than you were beforehand. So, how do our providers benefit, right? How do our doctors benefit? Bringing them this to them, you have to really talk about whether or not it's even beneficial. For them, they did the surgery, the patient goes home, and the insurance company and everything takes care of the rest. But I bring it to them and tell them, listen, having us there reduces complications, reduces the patient calling you or searching for you and trying to find out, well, my leg is swollen. Why? Is it too swollen? I'm in pain. Is it good pain? Is it bad pain? Should I take 2 pills? Why do I only have enough medication for 1 week? All these questions, all these issues, but they're not able to always get the physician on the phone, if ever. And the office, come on, they're barely going to spend time with you. But that concierge nurse will stay with you, will stay on you, will continue to call to make sure you're doing okay. It improves the efficiency and there's fewer delays because we get on it quick. That's the whole point, is to always be available. We enhance the doctor-patient relationship because while we're taking care of all the small things, the physician can really keep up to the bigger aspects and they could know what's going on with their client. Because what we also do is we make sure we keep a relationship with your physician and we let them in their office know how you're doing. Better data and quality improvement. We collaborate with these physicians and the surgeons. We collaborate heavily with concierge physicians, and they are used to having us around. They enhance their practice reputation. I let them know because now that patient's getting quality care from the surgery table to when they get home. They're getting high quality care from beginning to end. And that will only increase in more patients who want to actually contend with you. So we tell that to our doctors because it's the truth. It happens and it works out very well. You won't really hear too many physicians that don't have a concierge nursing team readily in their mind, or the office have readily in their mind, that they can also give to clients if they're ready and willing for it. Now, this industry, the last numbers I saw in 2023 was like 6.7 billion. It's only going to get bigger and bigger. And that's because it's a good service. It's an incredible service. It's going to be double that and then some in 2032. And I know it's going to get any bigger than that because of all the changes in healthcare itself. And it's more than just the cash grab about it. When you speak to clients that have concierge help, they feel like the only patient. And if they don't, then you have more of an agency than you do concierge, because that patient should feel like they are the only person that you ever take care of. They should always feel special. Specialized concierge skills that nurses learn. When you become a concierge nurse, it's a whole different ballgame. My mindset, everything completely changes, down to even the clothing that you wear. Everything from beginning to end is professional. It's astute. It brings out the luxury feel because that is what we're giving to you. New nurses coming to concierge care, they have to build a strong foundational clinical skills, which we can't give you. That has to already come in. You're not coming into concierge care as a brand new nurse and you have no skills. We need you to have already gotten your skills in the hospital because that's your foundation. And now what we develop in you are the soft skills, which I'm going to go over. You're going to have your entrepreneurial awareness as well. especially if you're, independent agent, because a lot of concierge nurses in the game are all independent. Soft skills are non-negotiable. And so when I talk to nurses and when we go over education, there are certain things that have to be extremely clear. Emotional intelligence is key. You can't treat patients like they don't mean anything. I want to just raise a hand if anyone heard of that nurse that had a pregnant woman sitting in their room, and I think it was an ER doing triage, and she's ready to want to give birth, and that nurse is just staring at her screen, barely even paying attention. Can anyone raise their hand and see if they heard about that story? I'm not seeing. Okay. Yeah, you've heard of it, Ashley? Yeah. So I'll just give a little brief and show you why this is complete different, what we do. And it's sad to say, it was a nurse. It looks like she's been in the hospital for years. She has a woman sitting next to her who is giving her all the information that she's asking for in a very monotone voice. What's your name? When's your last pregnancy? And this woman looks very much like she's ready to give birth any minute. She's screaming, she's yelling, and it was sad to see that because you could tell in that nurse she lost a lot of who she was as a person because she allowed the burnout to kill her and to kill that greatness and excellence in her, and it shows in her work because God only knows what could have happened to that woman. Thankfully, she had a baby, 15 minutes after her 30-minute interrogation is what you need to call it. When our nurses go in, and any concierge nurse goes in, oh, that mind better change because then you have no weight in our business because it's all about the soft care, clear, compassionate communication. You need to talk to that patient like as if that was your parent, that you went ahead and you went to your savings or you went into your pockets or someone else's pockets and you gave all of this money and all of this to say, hey, you're going to treat me like dirt? No, 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 no. You're going to treat me like a prize, like I'm the best thing in the world, because right there and then their care is all that matters. Time management, self-discipline is heavy because you have to understand you are their care provider. So if you're coming in 15 minutes late, they may not look at you in the same light. They may look at you as someone who doesn't care because you don't even know how to stay on time. Accountability. No, calling the supervisor to problem solve. Do we work in teams? Absolutely. But am I expecting you to not take some accountability when you walk into that home? It is you. Our girls wear business casual, and that means something because I want them to understand that when you go in there, you need to represent not only the company, sure, but you need to represent yourself because it's you and your license in there. But you need to represent yourself and in a soft and in a kind and a warm way. Respect for boundaries. You understand that you're in their home and they have you and they're giving what they have financially to make sure that you either blend with their home or bring something more to their home. It's not a workplace anymore. It is truly a home. And that's what the feeling that they want to feel, that they feel safe with you, that they can count on you because they're going to have you do everything. So I want to just go briefly over who Careful is. I'm going to be wrapping up in a moment. So what we are a bunch of incredible nurses, RNs, LPNs. We give these beautiful post packages. We want to make sure folks understand that they don't have to think about the calculations on the numbers on how much. No, 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 no. If you are coming out the hospital, this is what I believe you should have. But if you want something else, that's fine. But here's the package. And we let them know what they're going to get out of that package. Excellent care. You're going to have better outcomes. You're going to have a shorter recovery time. We have our visits, our client visits. Our nurses go out for visitations and stay care, of course, because they can stay there for 4 hours, 12 hours, or 24 hours in the home, however the patient feels. We're flexible. What sets us apart even more so are our wellness team. So it's called Care for Lives and Wellness for a reason. We have CBTs, cognitive behavioral therapists out of Europe. And I really truly believe that talk therapy helps a lot of people. I'm getting a lot more youth who want to talk to CBTs because they're not pushing drugs. They're just pushing you to talk it out and talk about your trauma. We have IV vitamin infusions. We call it Luma IV. And we keep it very simplistic on the type of IV infusions that we do. We focus on immune support. We focus on energy. And then we have our hair care therapist. She's here too. Danny, I can't wait. I just love saying your name. And she does an incredible job with our clients to make them know that you can stay home and everything will be taken care of for you. The one thing we've learned in this gambit is that we don't ever say the word no. We always just say, let's see how else we can help you. Even if we don't carry the services, we make sure there's enough relationships where someone can. It's never no, it's just what else we can do. Let's build a recovery ecosystem that doesn't end at discharge. Even when you discharge from us, we want to ensure that you get everything you need afterwards and that we're always available when you need to come back or have to come back.